Okay, so the volume is pretty good, I think. 1, 1, 1, 1. Cool. So just so you know, like, so you don't feel like you have to kind of be tippy-toeing around and, you know, watching it.
Yeah.
Even if you stand up here quickly,
Yeah.
you can kind of see where I'll move, where I can move around, where I'm not in the way, you know.
Yeah.
So just see if I'm probably not blocking anything there.
No.
If you stand there to here, if I'm doing stuff on the back, you'll be fine, okay? So just don't feel like you have to be way out of the shot. Okay? Cool. So, first of all, I just want to show you how I might palpate the body, how I might assess the body quickly while someone's on the table. Okay? In my palpation, I'm sort of dispersing my fingers and hands over the body, like this. And I'm often sort of moving a big muscle or a whole muscle group together to see how things are moving, as opposed to what a lot of massage therapists might do, or actually a lot of people do it. They just sort of poke around with, you know, trying to find these knots, and that's fine. You just don't need to do that much. All right? And then with the Bowen move being so subtle, you don't want to confuse the patient or the body. What is actually the body work? You know what I mean? If you're rubbing and poking around, that's already a lot of stimulus that's going in. So with me, it's really like, it's sticking. I'm not sliding around like this because that's kind of, you know, can be a very impersonal kind of touch and make people feel uncomfortable. But when you stick, you can actually do the most subtle kind of movements and they never feel creepy like this. Right? So, yeah. So, you know, moving the skin, seeing how the skin's sticking, basically giving you an idea of how much fluid is kind of moving around the body through the muscle and through the tissues. And then getting like, instead of being like, is this part of the calf muscle? It's like, how does the calf muscle feel? Going, you really get comfortable going from one to the other. So even have a bit of a feel of Lee's. Yeah, you can see that.
Yeah, that feels quite calm.
Yeah, you can see on that side.
Yeah.
And so, yeah, it is. Sorry, I'll turn that down. It's on my phone. It's on one of my devices. One of the few. Yeah, they're just all connected, and I don't know how to make it so that only my phone gets the call without losing connections to everything else. So then what I do when I'm touching is I do this thing, right? Duck. It's like a duck. It's the easiest way to get people to remember, because most people will use the tips of their fingers, tip of their thumb. I disperse this thing over the whole fingers, so it's never pokey. I might look at a whole range of different things. I might look at the difference in the heel here. So if we look at it like that right now, the way he's presenting on the table, might lift up the quads so that we can make sure that everything's aligned there to see if that changed anything. And it did a bit, so there we go. We can see that sometimes the person's just laid on the table and one muscle's totally changing the way the whole leg length thing is. So, you know, leg length can be a very difficult thing to assess in my opinion. But still, if we look at it now, you can do that by grabbing the medial malleolus and bringing it in. But often then you might bring one leg in further than the other and give you an incorrect reading. I like to do it more like this, with one thumb at the heel and then looking straight down, and if anything, this leg looks a little bit longer. Okay? So that's one thing you could be looking at. You could be looking at how the ankles are rotating. Yeah. That's often a very obvious thing to see. You see one ankle in like that.
Or externally rotating.
Yeah, exactly. Now what we can see here is how his feet kind of take a bit of a different angle. Right, so I might even take a photo of that now because I want to show you the foot stuff on Lee. And then we'll see if how different it looks after. I might, look at structurally how he's presenting. I might drop myself down and check out the buttocks. Okay, yeah, the left might look a little bit down. The right hammy looks like it's a bit stronger. I just observe and then I watch the body change as opposed to, that's a problem. Right. I like to see what happens. And it's very easy to pick up tension, but I kind of don't get too caught up on it. I like to observe it, work, watch it change, as opposed to, I've got to make this change.
Not always base your hands on where they're getting hurt. Like he said, it was pain. It might not actually be on that side. It might be somewhere else.
Completely.
Yeah.
Absolutely. We'll talk a little bit more about that and why I relate the anatomy trains a lot to that, but absolutely. Try not to get caught up that, he said he's got back pain, so I have to work on the back. For me, that could be so many things, and actually, if I'm trying to take pressure off the back, yes, I would do some moves to release, QL or rector spinae, maybe some of the buttocks and the IT band, and already I'm getting a bit more distant. But often I'll be more focused at releasing the front of the body and releasing psoas and releasing all the hip flexor muscles to take pressure off the vertebrae getting compact at the back. Okay, so yeah, definitely always not I'm really not like, I've got sore shoulders, all right, I'm going to address your shoulders. It's like, I don't know, it could be that. Yeah. Cool, so I'm just going to stop start, so that might be easier to kind of segment a few things here. So what I'm going to talk about now is slowing the Bowen move down. Very effective. I learnt this through a woman that my mother met, and she was a person who actually used to teach for Bowtech. And she used to do this technique. She developed this technique. She, after doing Bowen for a long time, felt that when she slowed down her moves, she got an increased effect. And she passed this on to my mother, and I've really put it out to a lot of my students and had pretty much every student I've then taught and just suggested, you don't have to really teach much, you just suggest, apply it like this a bit more, have had an increase in results in their treatments. So basically I'm just going to show you what the pace might be. Okay, so how it might differ from what we typically do. So I'll start off with 1 and 2. Give me a bunch of nice deep breaths, please, Lee. So I just usually make the move when I feel like it. I don't really think about it and count. Sometimes I might at least count a couple of breaths, so that I can kind of slow myself down. But then when you make that move, it is slow. See how very slow it is, as opposed how it kind of feels. Instead of flicking, kind of feels more like you're grabbing that muscle and kind of moving the fascia. Yeah, as opposed to feeling a flick much at all. Right. Okay, another nice deep breath, mate. For a couple of them. So I'll really kind of focus my breath and my energy, and I'm really focusing on that move. Focusing on their breath. You really get connected to not just yourself, but to people. You know, you really get to know people's breath a lot. So that's how slow you could easily do a whole treatment. What I find with that kind of treatment, you really can remove the need or the feeling that you need to have a wait time. It's, you know, it's so, it might take me now, you know, that long again just to do some moves on the legs the whole time that's responding. So I find that this creates a really nice pace, it really gets a nice rhythm going. And yeah, whether, you know, how, you know, I've brought this up with Rob, and so how this might work, it gives a lot more information to the nervous system. Holding that point there, the communication in the body opens up a lot. So whether it's a physiological thing, it probably is. Then there's people who actually, since I've been sort of focusing on this, I had a call a couple of months ago from a woman who said she'd done a bunch of Bowen courses, and she did this one Bowen course, and the only thing that this guy did differently was really getting people to put their energy into the move more. A lot of people might flick a move with their thumb, and nothing happens in their body. You can literally just do these sort of things, right? But with me, I try to encourage people to, you know, that's how I might do a move. It's like this kind of thing. It's not like that at all. And so his whole thing is put energy into it. It's a little thing that I do and try to teach people, but it's probably a really big, important thing. So, you know, holding the points for longer really brings people's energy into it more. Both the patient also, I feel, in my perception, takes each move more seriously, for lack of a better word, right? They really know that was the move. Sometimes it could be like twang, 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 flick, flick, flick. You don't really connect with it all, where with this, when you really slow it down, you give them seconds to connect with that part of the body, and it's really nice. Give me a nice deep breath, please, mate. Fall apart when you breathe out. Now just let your breathing go back to normal, or however you feel drawn to breathe. Keep it deep if you can. So I just want to see if we can get some change in the hammies quickly. Are you comfortable with biceps femoris move?
Sometimes I get lost in that move.
Okay.
I either take it to medial, it's decided to, I don't go laterally.
Okay, right. Yeah, I know what you mean. And then sometimes it's easy to get the IT band as well, especially on people who are really tight and sinewy.
Yeah.
It all just turns into a big lump
Yeah,
down there.
exactly. Then I just lose it.
Yeah. So easier way, just to lift the knee up if you don't already do that.
No.
Yeah. So you lift the knee up, even if you come have a feel here right now, you'll feel that.
Oh. Oh, the hollow.
No, just beside it. So here you'll feel.
Oh, yeah, yes,
that,
yes,
right.
yes.
When you're down here, it's all just like a tight lump.
Yes, yes.
Bring it up and you'll be able to find it. So then you put your thumb there. There it is still.
So you get underneath it.
No, you just locate it. You're just like, oh yeah,
Oh, yeah.
there it is.
Yeah.
Now if I just hold my finger there, I'm going to be on it. And then just go backwards a little bit to apply the challenge.
Okay.
Just holding, 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 and
But also when
slow.
you do it that slow and that intent, you're actually letting the nervous system just relax too.
So much.
Yeah.
It really is epic. It's like the easiest way for me to teach someone to give me a treatment that makes my body feel the best without, sometimes when people flick around and twang and twang and twang and get twangy and flicky, I feel a bit
On edge,
and it takes a while for my body to kind of deal with it all. It feels like, whoa, I've just been bombarded with impulses.
Yes.
Where this way, really, so it just affects me completely differently. And yeah, if relaxation's important, I find it's also a much more relaxing treatment for people. That's where that book comes in a lot. I'm just leaving a bit of a wait time here. Cool. Now what I want to do is that could easily be enough for the back of the body. So I want you to be comfortable with that. Be comfortable with what you've learned. Be comfortable taking that in, okay? And so I want to show you some other stuff now. I can go back to this. I can tell, be comfortable turning people over. It's like, okay, I want to do this. I want to turn you over now. So Leo, I'm going to get you to hop on your back for me, please, mate. I'll often get something quite low. Come up a little bit for me, mate. Not towards me. A tiny bit more. There you go. That's it. Thanks. So something to kind of keep their neck slightly elevated, not too elevated. That's kind of perfect. Then I can go in there at any time without having to take the pillow out.
Oh, good idea.
Yeah, cool. So now I'm going to show you some stuff on the abdomen. I might get this over here. Now what I'm going to get him to do, so that's that move. Pretty straightforward, super effective, and hopefully you can remember that. Still wouldn't hurt to have a bit of a go now and see if we can do some more work around here. I'll often rotate the feet like this to see where if I can feel any restrictions further up. If anything, it's still that right leg. It's a bit harder to rotate it. Could be RTB. Now, Lee, what I want you to do in a sec is lift your leg up, push against my hand. Go for it now with your left leg, actually. Yeah. Okay, let it go. Other leg. Okay, do this leg again a bit harder, push up a bit harder, try and lift it off, yeah. And this one as well. Okay, so what you can see here is when he does that, that hip's going down completely. That means his core's not activating properly. What would happen is that hip shouldn't drop if someone's core's properly stable. It would be hardly any effect there. Okay. So whether we can do that with doing some work, and whether we can give some strength there, because that was also very weak. The weakest link was that. So now you could go and we'll go see what we can do. Before we do that, I'm going to get Lee to lift his leg up. So keep your legs straight, Lee, and lift your left leg first, as far up as you can to where you kind of really can't go any further. Okay, he's pretty flexible, good. Put it down, other leg. That one even looked like it was a bit more flexible. Alright, cool. Now do it with your knees bent, just one at a time. Straighten this leg, do that again to where you can go. Okay, yep. Other one. Okay, cool. Alright, yep. It is. So we could do, so just so you could see how I do the psoas the other way. Belly button, ASIS is there. Right. Right in the middle of those two. That's where you go. There. Deep breath. And the exhalation, as they start breathing out, I'll start to go in. And make a move there, you'll feel it strong. And I love it, I love to do that to people, because then they know why I'm here.
Yeah.
Otherwise, if I do that soft stuff, and they're like, what was the point of that?
Yeah.
I'm also going to do TFL. Leave that for a while, and then we'll retest. First I'll test strength in a minute. Actually, you know what? Look, we'll do it for more. I was going to do, because I really feel that iliacus needs to be done, but I'm not going to. I'll do it systematically. All right, now lift your leg, resist my hand. Still very weak. His quad's taking a lot of the pressure there. Do this one as well. This one, this yeah, it's so much more intelligent for how his core fires there. Okay. Now lift your leg up again, straight. It's gotten further. Other one. It's got further still, and just with your knees bent.
How long does the range issue?
There you go, look at that, that's even better again.
So much good.
Yeah, cool. And then that's not even doing any iliacus yet, we just did psoas. And so yeah, what were you going to say, Magdalene?
How long does it usually last for?
Well, I've never really tested and waited and seen, you know, and that's a difficult one.
Say, oh, you know, I was feeling really good, and then they said, oh, we came back the next day, or...
I feel that typically it'll last for, you know, unless someone goes out and does something crazy or doesn't drink any water after they've seen me, I'm doing iliacus.
Yeah.
And then it might come back, but usually you can kind of, sometimes they won't have any restriction again for months.
Yes.
And the next guy comes back next week and he's like, oh, it was good for a week. Yeah. But definitely think that it's possible to just get rid of that restriction, okay?
So if you're doing you're going just across the pelvis.
So here I'm doing iliacus.
Yeah.
There's the hip, iliac crest, going in there. I'm making those moves. Yeah. Reaching
so
in.
Is that 4 times you go?
However many. You know, it might be 3 on one guy, the next guy I do it 5 times,
Oh, wow.
and I do it twice because I feel he needed it again. So yeah.
So those numbers of how many times you like
A, B, C, D, E, F, G, H, I, J, K.
Yeah. That can be.
That could be 5. It could be 2.
Right.
It could be 1.
Right. Okay.
You're just stimulating that line.
Yes. Okay.
Yep. All right, Lee. Now do it with your knees again. Knees bent. Yeah, look at that.
Yes, so much more.
So much more. That was on the right angles before. Side. Yeah. Sweet. Thank you. So then you could talk through someone. Talk to someone through it. Where do you feel restriction now when you're bringing your leg up?
Don't really feel that restricted anymore.
Okay. So I'd be going to hammies, but they might say they're transverse abdominis. I don't know. They might go, that's not firing properly. So
Have you gotten some people where they've gotten tingly after a move?
Yep.
Yeah.
All sorts of weird stuff. So I'm just going to do hammies. So here you can see also you don't need to just be doing hammies in the one position. I'll often get here like this.
Yeah.
And do hammy like this.
Yeah. Well, they taught us to come about this end.
Okay.
Yeah. So you lean into it, get into the just above the ischium, shin,
Yeah.
and then open it up.
Yeah.
Sit like
Okay, cool. So yeah, you can for sure. You can even lift the leg up if you feel like you need to get in there more. And there. Let that leg be nice and heavy, Lee.
I saw the video of one, I think it was a YouTube, where you were doing a massage.
Yeah.
And they were getting like moaning. What kind
So,
of massage is that one? They were
that's
getting that release.
yeah. That's
Is
the
that
guy who
what
taught me
happened?
that's called Raynor massage. I started teaching my own stuff because I kind of did it a little bit differently and sort of brought my own touches to it and started teaching
What
it
does that
myself. But
relate?
it really relates to moving shit out of the body
Really?
at emotional levels. Really like getting emotional baggage off.
Wow.
Yeah. And you're getting a lot of oxygen. All right, Lee, can you lift your leg up straight this time, please? The hip worked heaps better then. And we might have a little bit more movement there. That leg is even going further back again. Anyway, so for you, whether you are good at doing assessments like this, use them, talk to people, where do you feel it, assess, watch, learn that way.
Okay.
For me personally, that was never a big thing. And it was probably, it could be it could be the only area that I haven't focused on enough. But I just never got drawn to it. And because again, the questions would come up, how long is that going to stay like that? And I felt like I never needed to convince my clients this is doing this. But then there was definitely those, I've learned the hard way. Well, not the hard way, I've then learned that then when I've shown people, they're like, oh my God, whoa, this does that. I had no idea. I thought it just was relaxing and felt good.
Oh, right.
I'm like, no, this does heaps, you know?
Yeah.
So it's all often good, whether it's at the end of a treatment, to show them how you could then just increase their range of movement through 2 moves. They're like, whoa. And then that just sinks in that, well, that treatment was half an hour of all of that.
Yeah.
Makes them think of it.
When you're doing something on the gym floor or something quickly, do you still have to do the...
No way. Not at all. I had heaps of guys come up to me at the gym. They're like, oh, dude, I just was boxing and I got punched in the jaw and my neck's hurt sore. And I'll just go tweak. And then just hang there for a couple of minutes and I'll keep working out. And then I'm like, all right, sweet.
Oh,
And it's just like,
Yeah.
dude, for sure. So try to isolate as much as possible the moves and just do one thing.
Yeah.
So spend 30 seconds. Learn from it that way.
Yeah.
As opposed. So this sequence I learnt from Mind Abdominal Massage, and I took it away and I explored it with Bowen therapy moves and had amazing results with it. So it took like maybe a 15-minute kind of treatment down to minutes. It's incredibly effective. It's not just for the abdomen, it can be very good for female reproductive system. So I've had women that I've shown this to who've had really fantastic results with all kinds of issues around the reproductive system. Okay, so if you ever get someone with anything around that area, and they, it's obviously not a cancer or something, but it's just a condition, fantastic. Okay, so what you're going to do is make a sequence of moves towards the middle,
Towards the belly button.
towards the belly button, right? And how I start is I start with the one that's the most, psychologically invasive. Let's say, you're starting quite low. Pubic bone is about here, but depending on the person's anatomy, you can often use the ASIS as a guide. You don't want to be reaching into pubic hair to make them feel uncomfortable. You can obviously do this in the sheet as well, but just so you get a visual of where I'm going. I'm going to go down and make the move up. Apply a challenge, make the move towards the belly button, and then you stop there. Then there's the ASIS, there's kind of like the base of the pubic bone, and you're kind of in the middle here. And you're going to do that. Then you're going to make some moves starting on the external obliques. Great for digestion, digestive issues. It's also going to help with just releasing all the different muscles around the abdomen, be it psoas, be it rectus abdominis. At this point I might move around the table.
Oh, okay.
I usually do it with my fingers in that pulling way. And then the last set of moves. And you're always stopping just before the belly button. Then the final set of moves is right next to the belly button. This is based on a Chinese medicine principle move to stimulate the digestive system. And you're just making these little form moves. I'm just doing it again so you see. Just around the belly button. Okay. Really good for getting the digestive fire activated. Again, we spoke about digestion and stuff, and we said a whole bunch of things about reproductive system. I try to just sort of make sure that people have this in a broader sense, so we're not then, oh, what was that? It's only good for that. Knee procedure is good for the knee.
Yes.
Knee could be good for back pain.
Yes.
This thing might have a heck of a lot of uses that you'll begin to learn.
Yes.
Okay.
And you wouldn't typically do that again like you can for other moves?
For sure. And then, so this could be another move that you could just put in here, and it could be good to get the pelvic floor. But this is part of a procedure for bedwetting. So Lee, what I'm going to get you to do is just bend your knees up, keep your feet on the table, but just bend your knees up. Yep. And then when I say so, or no, what you're going to do is I'm going to say, take a deep breath. As you breathe out, right at the end of your exhalation, you're just going to kick your legs down like that and let them drop, okay? Okay, give me a nice deep breath. And you just hold your hands here. So I've applied the challenge, and I'm just pulling back and holding. As they drop their legs, you keep the tension, and then dropping their legs increases it.
Oh, okay.
And puts a bit of a stimulation impulse quite deep down into all the pelvic floor. Okay. That's also part of the... This is going to be another move that isn't in the course yet. I might even get you to take your top off if that's alright, brother. Thanks, mate. Cheers, Lee. So, we're going to do different move therapies, Dawn spinal therapy and some physio ideas. So, to do this move, one thing you got to be careful of, and you want to is the position of your patient's neck. So Lee, what I want you to do is bring your face out of the hole for a sec, please. And then what I want to make sure that you do is when you put it down for this, that your chin is on the bottom of the table, so that your chin can't actually fall through. Okay, so you want to have it say there, chin is tucked. His chin's tucked. You want to alleviate that at all costs, just for this, doing this move so specifically. Because we're going to, there's similar moves where we've done these. It's that same move going down the whole spinal column, but we're going to actually start up nice and high here, hence why the chin needs to be tucked to give this support, because we're going to put in another move into this. So grabbing the slack up, really feeling the spinous process. Take your time to feel it so you know you're there. Slack up. Down, make a move, and then pump. You're right next, the spinous process is right in the middle, and you're pumping up and down 5 to 8 times, moving to the next spinous process. You might miss some in the neck because they're so close together.
And why would you do this for people that have any particular signs of what? Just tension in the neck, or headaches? Or?
I'd say anything going up the whole spine, any discomfort through the whole back here, whether it's lower back pain, whether it's neck pain, whether it's shoulder pain, traps. I would do this move for just about any back pain. And so this is how Rob and I kind of came up with this, is that the stuff that we did on the foot, that I show, the advanced stuff that we do on the foot is really focused on the bones. And so through that, and through acknowledging that just doing such a very limited bunch of, putting such a limited bunch of stimulus into the foot, the bones of the feet, you can have them increase their range of movement dramatically.
Wow.
So through doing this, you don't need that much to stimulate the body for it to respond in a beneficial way. And
so you're going to go all the way down?
All the way down, vertebra at a time, mobilizing the joint, addressing the fascia, addressing the multifity, the rotators and the fascia around the spine, and then you're getting in there with the mobilization of the joint. It's such a comprehensive spinal treatment.
What have your clients said afterwards?
Everyone loves it. They all comment on different things, whether it was someone that I helped with the back pain, someone might say that they feel a lot clearer and a lot lighter and they're standing up straight, their chin's tucked down, For myself, it's helped me with a lot of different things in my back actually, but very good for when my neck flares up. I often get this neck pain which is around stemming or involves a lot of discomfort around C6 and C5. And
did you have an accident?
No, didn't have anything as far as I know. If it was, it might have been surfing or something. Yeah. So I'm taking this just so you know, after all the way down onto the sacrum. It's not going to hurt to stimulate the joints of the sacrum. Right. I'll also pump on the sacrum a little bit. Walk around the other side. Great. So, yeah, fantastic stuff there. Love that move. We only kind of worked this one out together about,
did you?
Yeah, about a month and a half ago. And Rob worked out this move there on someone that he'd been seeing for a while who he couldn't improve their range of movement in their neck. No matter what he did everything, and he's just like, okay, your neck's still tight. And then he figured out, well, thinking about the whole function of the head and neck, he figured that he might try and release the multifity of the spine. Did that move the first time ever, and the guy was like, wow. And so that was how Rob developed it initially, and then we combined it over that time we spent together where, also there's a woman called Sarah Keys who's a physiotherapist. She does that palpation purely on the bones with not addressing any of the soft stuff. So that's where I'd also heard about that technique from. But then learning that foot stuff from Neil Skilbeck and just seeing very gentle, manipulation of the feet and wiggling some bones, that it totally changes the whole way the feet work.
So would you do that in the beginning of a treatment?
For sure. Yeah, absolutely. All right, so what I want to show now is the kidney. I hear how I might do the kidney procedure and what I might be looking for in the kidney procedure. So when it comes to the kidney procedure, what has been suggested to me when I learnt it was that you feel the kidneys and you find the side that's warmer and you do it on the warmer side. Now, to me, I took that away and tried it and it worked, but then I also, from knowing traditional Chinese medicine, I also know that sometimes the side can be much colder and I'd rather warm the cold side. So if I feel personally that one side's way too cold and the other side's hot, I often do it on the colder side and then bring heat to it, right? And that works great. So right now though, maybe, look, Lee doesn't to me feel like he's got any kind of heat. Beg your pardon?
Liver issues.
Well, just like, I don't feel that he's too hot. Right? If anything, this side feels like it's a little bit cooler down here, and this side feels a bit nicer and warmer and stronger. Right? So, to test this idea, even you have a go here, have a feel. Actually, that side does feel quite warm. Now that I say it, I might sort of do it on that side, but you'll feel that it's only maybe...
Oh yeah, definitely cold on this side.
Yeah.
Yeah, definitely cold
Yeah.
on this side, yeah.
Yeah. And that feels kind of cold, you
Yeah.
know, it doesn't, that feels normal.
Yeah.
That feels cold.
Yes, yes.
So I'm going to have a go and doing it on that side. So you're doing it on the opposite side. Taking the foot up to right angles like you do with the block for doing coccyx. I might just zoom out a bit.
Oops, sorry.
Sorry, no, that's okay.
Would you use some oils when you do Bowen?
Yeah, hell yeah. I'll show you some oils. Actually, we might even do some on him so you can see how I use them now that you ask. It's on the website, but I'll show you in person as well. So we're just going to do kidney procedure here on the colder side as opposed to the hotter side. We're going to bring the foot up to right angles. We're doing this on the opposite side, so here we're about to work on the left-hand side of the body, but we're standing on the right-hand side. Get a nice, firm, comfortable grip of the ankle. We're creating a block here to contain the energy within this part of the body. Lower that leg out until it sort of stops naturally. Do it quite slowly, so it doesn't make someone uncomfortable, because that can be often quite tight. And
Does his face have to turn?
no, I kind of keep him in there. And give me a nice deep breath, Lee. Lower the leg. Cover them up. I'll often, when I do this sort of procedure, will give them some extra warmth down there, and so we'll let him respond for a while purely with that.